Health informatics is not a thing, it's a way of looking at the world.
It's not just about what happens in the doctor's office anymore.
I think the definition that I like best for medical informatics is Chuck Friedman's fundamental theorem of medical informatics, which states that using information technology helps a person extend their cognitive capacity, so it makes them more able to do their job. So health informatics is people working with information technology to better enable them to do their work.
Most of the way I've seen it defined is the intersection with health information, computer science, and healthcare and health systems. But I think that's very linear and very narrow in what it is. For me, what health informatics really is about is how do we take all of these tools and have everybody able to manage healthcare systems and their own personal health in a better way. That's whether you're the mayor of the city, whether you're the dean of medicine, whether you're the CEO of one of the biggest health organizations, or you're John Q. Public who just cut their finger. That's what it's all about.
The average patient changes hands, so to speak, maybe as many as I forget what the number is, but it's somewhere between 3 and 4 times on an admission. Every one of those would be so much safer with a robust information platform. That's what health informatics is all about to me.
Although it is very tempting to think, gosh, I could just scribble this down. Remember, you just said scribble, and most of it is scribble. And to think that you have to decipher a medical document which is a scribble that is unintelligible. I think for years the system has compensated for how busy and overworked we are. And I think it is time for us to stop and consider whether an investment of our time is going to be an investment in the system and an investment in patient safety.
It's kind of that whole envelope of, instead of a stack of charts like this, it's about having it sitting there electronically, easy access, easy transfer.
Why my bank transaction, it goes from here to somewhere by 2-3 minutes, and my health record from Dartmouth to Halifax takes maybe a month to get there.
You got to get over the paper and pencil route of doing everything, and we have to be able to use information in every single thing we do.
It is just humanly impossible for health professionals to have all that information at their fingertips and all the knowledge about the new drugs and treatments and any other interventions that are out there available to them. It is at that point where health informatics becomes a support mechanism to the healthcare professionals.
Health informatics is not about the health system, period. It's much bigger than that.
I see communication technology in particular and informatics as a discipline applied on top of that technology, as a profound changer of the way we practice medicine over the next 10 years.
Health informatics for me is a very powerful tool that is very fast becoming my best friend.
If you are not becoming informatics savvy, you are a dinosaur. It's over.